in this chapter we will learn how to tie a reef knot. Basically it's a two-handed reef knot. This is the short end and this is the long end with needle. First of all, you will pass your hand under that, and then after that, it is also known as index finger knot and the middle finger knot. In the first step I will use the index finger, so make some logic so that your small thread comes underside and you are saying that it's straight. You will not leave this thread, just make this thread like that, and after that put that long thread on your middle finger and slide it back so that it comes behind. Then in this moment you will apply the reef knot. Just you can see that the typical picture of the reef knot tied here. In this video we will study tying knot at the depth. For this purpose there are many structures deep in the abdomen and we have to tie the knot like blood vessel. So in the first step you will make a hook around that structure. So you have, this is the shorter end, this is the longer end with needle. So again you will make movement like that, and after that the logic is you will press the joint and you will push the long end, so it will go into the depth in this way. In the same way again you will repeat the same maneuver and it will go inside. In the depth you cannot tie like that, so it is not going inside, so it will create a problem and hence its end. Laparoscopic Mishra's knot. In this knot, first of all take one hitch, then like that. After that take one round, then a half hitch, then one wind, then half hitch, then after that again the last wind and the last half knot, and finally with the help of the knot pusher you can push it. This is the most secure knot as compared to Roeder's and the modified Roeder's knot, and this was invented by the great surgeon Dr. Mishra's. Roeder's knot. This is also known as 1-3-1 knot. First of all in one hitch from inside, then after that one turn from outside, again one more turn from outside, and at the end last third outside round, and at the end this is the position, and at the last you will take from inside and you will pass from this hole. After that you can slide this knot easily. This is Laparoscopic Roeder's knot, very basic knot, and it's a secure knot. That's end. This is the modified Roeder's knot, which is also known as 4S Roeder's knot. First of all take switch like that. After that one complete wind, again one complete wind, again one complete wind, and at the last fourth wind, due to which it is known as 4S. Now from the just you can see 4 winds. From inside take suture and pass from hole. Again take the suture from the right limb and pass from this hole. Okay. Well, after that just your process of knot tying is complete. You can push it with a knot pusher, and you can slide like I am sliding in the video. In the close-up view there will be the 4 circular on the knot. So this is the final view. Thank you so much. surgeon's knot. This is the knot in which the first loop has two throws and the next loop has only one throw, just like a scare knot. This is not too much pretty looking knot, but this is the secure knot. You can see that in the close-up view in the first loop. Second loop has only one throw, just like the simple knot. At the end of the video, you can watch the definition of the surgeon's knot. Here is the definition. This is the shorter end and the other is the longer end. First of all, take a single hitch. After that, you go to the other side and pass from below upward, so you come on the other limb. And then after that, pass this short limb around both the limbs, and at the end introduce this limb from the first hitch, and our process is completed. The good thing is this is the locking knot and there is no issue of slippage. This is not a slip knot. The good thing is that you don't need knot pusher. You can do it with the help of Maryland also. Here is the close-up view of the knot. You can use this knot for the vault closure and the bird suspension also. Thank you. Tail side knot. This is the shorter end. This is the longer end. First of all, hook around any thing or the finger of the assistant and make one hitch like that. After that, wind the shorter end around the longer end first time, then second time, and third time. After that, pass the shorter end from the hole which is made first and make the hitch close to the knot, and after that you can slide this knot. This is the laparoscopic tail side knot, and this knot is very famous in the Europe. So in the close-up view, this is the shape of the knot. You can clearly see. Thank you so much. Laparoscopic tumble secure knot. First of all, take one half knot like that. So after that, take also another half knot like that. So here two scales are there. If you clearly see the knot, at the end right side of the thread is on the right side, left side of the thread is on the left side. After that, you just push both fingers, and after that tumble it. Tumble means when you straighten the thread, it can slip now easily. After that, it becomes locked. If you push both the limbs, then it will become scare knot. If you like our content, if you learned something from our videos, then do subscribe by clicking on the red button below. So thank you so much.